Eat up, ready to go.
Yeah, here we sort of are demonstrating some of the other adaptations we had to make during COVID. So normally when I round in the intensive care unit, we kind of round in a large group. You know, there's residents, fellows, the bedside nurse, nutritionist, pharmacist, and it can be a very large group. And during the pandemic, we really had to be mindful, keep our own providers safe, and minimize sort of group congregation. And so we came up with another way to effectively communicate information about patients during rounds. And so what you see here is kind of the solution we came up with. So on the right-hand side is one of our physician assistants, Jen Bohannon. She was actually starting, I think, with us around that time. And she likes to joke that we sort of offered her up as Tribune because we would outfit her with this eyepiece camera and a microphone, and she would wear it under her personal protective gear. And then we would send her into these COVID isolation units where she would kind of be like an on-the-scene reporter with our bedside nurse being our eyes and ears right at the bedside while the rest of us could space in a separate room. And here you see on the other photo, we are Zooming from a separate location with them doing rounds, you know, sort of integrating the data of the day, coming up with a plan for the patient so that the nurse was, you know, up to date with what our goals were. So this was a big change in how in our sort of day-to-day management of these patients.
Well, interesting how that camera